Are there advantages to aging? Yes, I am Debbi-Jo Horton, and welcome to Advantages to Aging. Join my guests and I as we discuss aging and what makes for a healthy lifestyle, which results in a quality life. Thank you for joining me today. Hello, listeners. Welcome back. You are going to get a little taste of taboo today. Today, I have with me Dr. Micahel Green, who's an OBGYN and the Chief Medical Officer at Winona. And we are going to talk about menopause and about what to do about that nasty little several letter word that starts with an M. Welcome, Dr. Green.
Hi, how are you? Thanks for having me.
I'm glad somebody can laugh about menopause. So I wanted to kind of get into the subject of, like when we talk about menopause, we often talk about all of the symptoms. And a lot of women feel like I just have to deal with it. There's nothing that can be done because they've heard about all of the nasty things that happen when you start taking hormone replacement therapy. So can we talk a little bit about the history of that? Can you give us some insight as to why people might kind of immediately shut down when their doctor says those nasty little words?
Yeah, I'd be very happy. I have enough gray hairs that I've lived through a lot of the history personally, and sort of seen the progression and the big change that happened with hormone replacement therapy and how we look at it in the medical world. And the pendulum swung way crazy to the negative side, and it's just starting to swing back. But when I came out of residency, I finished residency in 1999, we were basically giving hormone replacement therapy to everyone. And, really at the time, that was the best data, was that was a good thing to do. So it's not like we were trying to hurt people. In hindsight, kind of some of what we were doing was a bit crazy, but at the time, it seemed like the right thing. And I mean, we thought hormone replacement therapy was like vitamins, that everybody should take one. There's really no downside. It makes you live longer and healthier. Why wouldn't you want this? And we were, writing it to 70, 80-year-old women, which, really wasn't the right thing to do in hindsight. And what happened was this huge study came out called the Women's Health Initiative Study, the biggest study ever done on menopause. It was this groundbreaking study. And ultimately, really what the study said was that, hey, this thing's not a vitamin. These are medications and they have risks like other medications. And you ought to think a little bit about it before you prescribe, because what's happening is a little reckless. So that was basically the moral of the story. But unfortunately, the media got ahead of it and the headlines came out, hormone replacement therapy is killing women. Doctors are prescribing hormone replacement therapy, inappropriately. Stop your hormone replacement therapy. And everybody panicked. The doctors panicked, the patients panicked. I can't tell you how many phone calls I got. And everyone just stopped their hormone replacement therapy. And it was really hard time for women because the ones that were on it appropriately, all of a sudden they were just miserable and really suffering from this. But again, it was this sort of reactionary thing, which unfortunately is the way medicine often goes. And it took a while. I mean, these headlines came out before the study was even published. So it really took a while before, we could really see what was in the study. And by that time, it was kind of too late. The damage was done. And this was just sort of the common feeling was, hey, stop writing hormone replacement therapy. It's the wrong thing to do. And that really wasn't what the study said at all. So because of that, HRT sort of became this big taboo thing. You were a bad doctor if you wrote it. You were doing terrible things to your patients. Everyone felt bad. And we were trying to figure out how to help these women, without giving them the medicine they needed. A secondary effect of this, which I didn't even really think about until recently, is that there was a whole generation of doctors that were never trained on hormone replacement therapy. Because people that were in residency sort of after this happened, maybe for 10 years, there's a lot to learn when you're training. And so their mentors were saying, look, don't waste your time on hormone replacement therapy. This is a historical thing. Nobody's ever going to use this thing again. And so there was no training on how to use it, how to do it right. And I'd say 10 years of doctors came out with essentially no training on menopause management and hormone replacement therapy. So
Which is
it
too
really,
bad because most women can't forget about it.
right? No, exactly. It's it's a huge problem, and it's created this sort of hole where people are either afraid to do it or they don't have training. And even as the pendulum starts swinging back a little bit, doctors aren't going to prescribe things that they are uncomfortable with and don't understand. And so a lot of doctors are just passing and saying, you know what? Yeah, there's data now that it's good, but I just don't write hormone replacement therapy. I don't feel comfortable with it. It's not something I do. There are whole healthcare systems. Kaiser Permanente, the biggest insurer in California, not 100%, but pretty much as a policy, doesn't do hormone replacement therapy. It's amazing, really. So this has created a big problem.
Which two words describe your dream hair? I'll go first. Radiant and smooth. Neora's professional level Proluxe hair care system works synergistically to seek out and repair damaged hair, helping you restore your healthy, youthful looking shine, strength, body, bounce, and manageability. Now, whether or not your words would be curly and shiny, silky and straight, any of those, this same hair care system will work for you too. If you'd like a sample, be sure to subscribe to our podcast community and reach out and let me know. I'd be happy to send you one. Back to the show.
The other interesting thing that happened is that the medications themselves improved over this time period. So it used to be that the best thing we had was a hormone called estrogen called Premarin and a progesterone called Provera. And so Premarin and Provera was the sort of standard hormone replacement therapy. There were some other things people used, but that was basically what everybody used. And in fact, that's what was used in, basically all the big studies. Mm-hmm. And at the time, it was the best that was there. But science is good, and the guys in the lab figure out new stuff, and they've come up with better ways to do it, safer, more effective hormones with less side effects. But again, you have this whole generation of people that never learned about it. You have sort of the old guys like me that used to use Premarin and Provera, and that's all they know. And unfortunately, a lot of people haven't kept up with some of the new changes. So Premarin is actually a really interesting drug. The name Premarin derives from pregnant mare urine, Premarin.
I recall that one.
Yeah,
not very fondly.
At the time, it was state of the art, but it is no longer. And it literally came from the urine of pregnant horses. And what they would do is they'd have these, what do you call a whole bunch of horses, but a
herd,
a herd, or a herd of horses, of pregnant horses. They keep them pregnant, and they collect their urine, and they basically isolate the hormones from the horses. And it turns out horses make a whole bunch of different types of estrogen. Over a dozen estrogens are found in their urine.
Who would have
known? A couple of them are also, it's really actually kind of interesting. A couple of them are also found in humans. A bunch of them aren't. They're still estrogens, but they're not really the same as what we make. But they they kind of get that out of the urine, they turn it into a pill, and that's Premarin. And so that was the estrogen that all the studies were done on. It's the estrogen that everybody sort of used. But it had a lot of side effects because it had all these different kinds of estrogens that weren't necessarily what the human body is used to. Mm-hmm. And then the progesterone that was most popular was called Provera, and it's still a very popular progesterone. And Provera is it's actually not a progesterone, but a progestin, which is what we call synthetic progesterone. So it's a synthetic progesterone. It's made in the lab. It's not the same as what the body makes. And so it has some side effects that sort of natural progesterone doesn't. One of the probably most common ones is that it stimulates appetite. So there's a birth control called Depo-Provera that's made out of the same stuff, and that's like famous for causing weight. It's a shot that you get every 3 months, and women will come in for their second shot 50 pounds up. They'd be like, eeh, and it happens. So that's, has other side effects as well, but that's sort of one of the big downsides of Provera. So
And I
not
think
only
that
do you
a
have,
lot of the listeners will remember, because most of the listeners are in that age bracket, will remember all those horror stories about the weight gain and the fact that, they were taking things that they were then told weren't good for them. And many of them, if not most of them, are reluctant to try anything new. And I guess what we're here to tell you, listener, is that give it a try, but be prepared. Like, not only does your doctor need to be up on all of what is new and improved, but you should be as well. And so, Dr. Green, if you can kind of take us down that path of what are some of the things that we should be as women asking for?
great. So actually getting hormones for your hormone deficiency is sort of the first thing. A lot of doctors try to, when sort of hormones were taken off the table, our patients were still suffering. So we tried other things to help. And there are some other things that help some, but they don't help like getting the hormone replacement therapy, because that's what your body really needs. So that's the first thing, is you need to find somebody that's willing to write you for hormone replacement therapy rather than giving you an antidepressant or a blood pressure medicine or something like that. There are some substitutes that right. I mean, there are some things that help a little bit, or maybe it'll take care of one individual symptom, but it doesn't take care of really all of the problems. But again, when people, are afraid, when you've taken away the best tool, you look for, another tool that, doesn't work so well, but it does something. And so that's what you want to avoid. You want to find somebody that is, first of all, willing to do it. The second thing is you want to find somebody that's up on the more current data. And there are hormones called bioidentical hormones now that are exactly, chemically, they're the exact match of what your body makes. And so they act exactly the same as the hormones that your ovaries are not making as well anymore. And so they really literally replace what you're missing, and do that with much fewer side effects. You can usually get away with a lower dose, and are a lot safer. The other thing that's interesting is that some doctors will use birth control pills for their hormone replacement therapy. And it's sort of another attempt at giving people some relief with a medication they're comfortable with. So OBGYNs write for a lot of birth control pills because a lot of our patients need birth control. And birth control pills prevent pregnancy. They actually do a good job at cycle control, but they're not real good for hormone replacement therapy. So there's really kind of two sort of types of doctors I've seen with this. One is the ones that really don't know better, never learned how to do hormone replacement therapy, or trying to get some hormones back to their patient, and so they use birth control. The other is the lazy doc. And I had a conversation. I was assisting somebody in the operating room doing a C-section, and he was asking about my company because everybody I'm working with is all excited for me. It's like, and he's like, oh, I just write birth control pills. I put them on birth control pills and tell them to take them off when they're 60. And I'm like, that's a really lazy way of doing it. Yeah, I know, but it works and it's fine, and I don't have to deal with it. It's like, well, it works some, but it has a lot of side effects. It's not the right way to do it. It's not even a good way to do it. It's really just a lazy way to do that. So birth control pills are fine if you're trying to avoid pregnancy. They're good if you're trying to control your periods, but they don't work so well for the menopause management. And so that's kind of to me, that's a red flag when someone just writes birth control pills for everybody. You see a 53-year-old on birth control pills, like, somebody's got a lazy doctor.
Yes. And hopefully, you're not going to get pregnant anyways. And most of us at that point don't even have periods. So the risk of pregnancy is pretty low. So as we wrap up, is there one or two things that you would recommend to our listeners to go ask their doctor about?
So I would definitely ask about hormone replacement therapy and about bioidentical hormones. So, bioidentical hormones sounds like a big fancy term, but they're really readily available. We're talking about, estradiol and maybe estriol. But estradiol, a simple way to do it is just estradiol and a micronized progesterone, readily available. Everybody can write these prescriptions. Much, much better for you than, say, Premarin and Provera, or particularly birth control pills. So ask for the help that you need. Ask about bioidentical hormones, and ask if this is something that they do. You don't want somebody having to look things up on the internet to figure out how to do it. That's not a good way to practice medicine. And unfortunately, sometimes that's what people end up doing. And they mean well, but that's really not who you want captaining your ship.
Right. And you have to be an advocate for yourself.
Really important. Yeah.
Well, Dr. Green, we really appreciate the knowledge that you've now armed us with. Make sure, our listeners, that you take at least one of those questions and take it back to your doctor. And then listen in for another episode where I will have Dr. Green help dive in a little bit deeper. That's all for now. This is your host, DJ Horton of Advantages to Aging. Thank you, Dr. Green.
Thank you.
Do you think one of the biggest advantages to aging is all the knowledge we gain along the way? Me too. What did you learn today? Share with me in my Facebook group with the same name as this podcast, Advantages to Aging. Now hit subscribe so you don't miss all the tips to come in future episodes.